Omicron continues to record a sharp spike across states, taking the total tally of confirmed cases across India to 64. As 3 more Omicron cases have been detected in Telangana's Hyderabad, a 7-year-old Bengal native is also among the infected people. Yesterday, 8 more patients are found infected with this variant in Maharashtra. Out of these, 7 are from Mumbai. 1 patient is from Vasai Virar. 3 of the patients are asymptomatic. 5 have mild symptoms of the viral infection. Till date, a total of 28 patients infected with Omicron have been reported in the state. Out of these, 9 have been discharged after negative RT-PCR tests. Delhi has added 4 more cases of the super mutant variant. So far, 6 people have been found Omicron positive. In Delhi, 1 of them has been discharged. Meanwhile, the COVID task force chief and Niti Aayog member Dr. V.K. Paul has called for modifying vaccines every year while raising an alarm that vaccines could become ineffective against new variants. He's also said that India should have vaccine platforms that are adaptable quickly with changing scenarios of the variants.
The best bet today, which the nation's policy dictates and policy amplifies, is that the 2 doses of the available excellent, highly effective vaccines, as we have seen up to now, must reach every adult. And that remains our prime philosophy. We should have no confusion on this.
These 2 cases are from the non-risk countries. This one person belongs to Somalia, the 23 years old male, and other person is 24 years old female from the Kenya. Okay, so they came to Hyderabad through the transit flights. Okay, Qatar and Dubai. We could able to trace them and we shifted them to the our isolated facility at the Gachibowli, and their contacts also has been identified. Further, their samples sent to the testing.
4 और कंफर्म हुए कल जो हुए थे, उसमें से अब 1 ठीक होकर घर जा चुके हैं।
और सर इनकी स्थिति क्या है? मतलब
ठीक है, सारे स्टेबल हैं, कोई ऐसा कोई दिक्कत नहीं है। जितने भी इस अस्पताल में लोग हैं सारे स्टेबल हैं, सारे के सारे ही मतलब इनके विदेश से आए हैं और दिल्ली एयरपोर्ट से इनको ट्रांसफर किया गया था।
किस तरीके के हालात रह रहे हैं?
अभी तक देखिए, अभी तक तो कंट्रोल में है। अगर ये फैलता है तो जरूर सरकार देखेगी इसको। अभी देखिए 6 केसेज अभी तक आए हैं और अभी तक कम्युनिटी से कोई केस नहीं आया। जितने भी केस हैं सारे के सारे एयरपोर्ट से ही आए।
Over 60 cases of Omicron in India right now. The super mutant has become a super spreader across the world. As India braces for Omicron threat, a demand for boosters and children's vaccine is growing louder. I filed this report earlier on how long will one have to wait really for the 3rd dose, and also how long one has to wait to get our children vaccinated against the new variant. "77 countries and counting. Omicron variant, the 5th variant of concern, has become a super spreader. And in the light of the new threat, countries are doing what they can with the little information they have, boosting against Omicron. But not in India. There is inertia when it comes to rolling out the 3rd dose. But the government insists it has its priorities right. Boosters can wait for the time being, is that what you're saying? Or are you saying that boosters for the immunocompromised can wait? The priority should be the 2nd dose in India?
Correct. Yes, that's true. And for the boost, the more you protect a larger group of the population, the less there will be transmission. That's the idea of vaccinating as many, rather than take it further to a smaller group. That's the idea, and we have to know more about the disease and the vaccine and with this variant before you can actually do some recommendations around boosters.
India is deliberating on the need to administer boosters. The government on Tuesday told the Delhi High Court that expert panels are discussing this. But experts say the delay is unjustified.
We have to fully vaccinate people. And if we have enough vaccine stock, then introducing boosters is a good idea.
Meanwhile, the World Health Organization has also said that boosters at this point in time, without vaccinating the entire population, is a risk and tantamounts to hoarding.
WHO is concerned that such programs will repeat the vaccine hoarding we saw this year. and exacerbate inequity. It's clear that as we move forward, boosters could play an important role, especially for those at highest risk of severe disease and death.
The government of India started its vaccination drive against COVID-19 more than 10 months ago on the 16th of January. Ever since, close to 90% of the population has got the first dose. More than 55% of the population has got the second dose. There is no shortage of vaccines unlike a few months ago. And this has what got the experts to question on the inertia of the government when it comes to both giving out the booster doses and also drafting a policy on vaccines for children. So where is the vaccine for kids?
The children carry the same viral load as adults, exactly the same viral load as adults. They are as infectious as adults and they can transmit as well as adults. Therefore, children need vaccination. It's been approved by American Pediatric Association. It's been approved by FDA. It's been approved by CDC. It's been approved by every European regulatory authority for children.
Okay.
India must have pediatric vaccination ASAP.
India has approved Zydus Cadila Zycov-D for kids above the age of 12, but the rollout is yet to happen. The vaccine will be given to adults by December, says the government, but is non-committal on when kids will get this jab. Another homemade vaccine, Covaxin, has got the recommendation for a rollout, but a formal nod from the regulator is still awaited. No other country in the world is administering the COVID-19 vaccine to children as young as 2, and this is something that is weighing in on, say, government sources. The government has also suggested that there is a possibility that existing vaccines may not work in neutralizing the Omicron variant.
We are watching the situation with regard to Omicron. World is trying to understand the science of it, but today and in immediate future, we must complete the task of vaccinating every adult with 2 doses of the vaccine.
A dozen questions around Omicron remain unanswered. But should India not make efforts to protect its population against an unknown enemy is the question many are asking. In New Delhi, Sneha Mordani for India Today.